You. I spent 20 years in the Air Force after a couple of ventures. Well, I worked at the VA for a while, worked in private practice for a while at St. Anthony's, and then I joined the Air Force in 1986. My family roots are that my great-grandfather was one of the early doctors in the Oklahoma Territory, and he got his territorial medical license, which I didn't even know there was such a thing, in 1900. And he practiced in Kingfisher, which is where both sides of my family are from 1900 to 1927. And you know, it's real interesting to hear that family history because first he had a horse and buggy and everything, and went out and did house calls all over and got paid in chickens and vegetables and things like that. Then he got a car. He was one of the first people in Kingfisher who had a car so he could go make house calls and visit people. But when you think about it, back in those days, I mean, that was before penicillin. It was before all kinds of stuff. And I actually have all his medical books. He went to medical school in St. Louis. And so I still have all his medical books. And they're just fascinating to read because there's things like great descriptions of a patient with pneumonia. And then it says, well, there's not much we can do and they'll probably die.
Oh, Lord.
That's so depressing. But I guess if that's the kind of medical care you're getting paid in chickens is probably a good deal. But you think about now, and I know Senator Coburn has suggested that we go back to that kind of system, but really, how many chickens would it take to pay for a heart bypass? You know? That's a lot of chickens, or a lot of vegetables. So, medicine has changed a lot, but I love that family history, and like I said, all my family was from here. Most of the people in my family have also served in the military. My dad was a pilot in World War II at the age of 18. He flew C-47s in Europe and Battle of the Bulge and all that kind of thing. So I could live anywhere. I've retired from the military. I have a great pension. I have great health care. I have no vested interest one way or the other. I'm not practicing now. I'm not working for anybody now. So I have no monetary or otherwise. But I care about the people of Oklahoma, and it breaks my heart that Oklahoma is always running, Louisiana and Mississippi, the worst health statistics in the country. It just drives me crazy, so that's why I'm involved in this. I also want to tell you a story about a patient that kind of illustrates how bad our healthcare system was before health reform. And it's the story of a 26-year-old kid who was young and healthy and didn't have health insurance. And he got a disease called Guillain-Barré, which is not a real common disease, but it's not that uncommon either. And what happened was he got paralyzed and was in the hospital for a while. And then he recovered and did okay. But he couldn't get health insurance. No insurance company in the world would cover somebody who had had an episode of Guillain-Barré. Well, then he had a relapse and got sick again. And his parents, who were in their 50s, used every dime of their retirement savings to try to keep him alive. He was on a ventilator. And, you can apply for disability, but that takes a while. And the medical benefits for disability don't kick in for a couple of years. So you've got a 2-year span of trying to keep somebody with a really serious illness that they could recover from alive, and it devastated the entire family. So no parent is going to let their child die if they have a dime in the bank. But they went into all this debt and everything. So, financial disaster could certainly happen in our old system. And part of the reason for the Affordable Care Act was because families were being devastated by medical bills, and the country was going broke paying for medical bills. So this was an attempt to try to help that. So in March of 2010, the Affordable Care Act became law. You will hear a lot of people refer to it as a bill. A bill is before it's passed and signed by the president. A law is after it's passed and signed by the president. So The Affordable Care Act is now law. And most doctors and nurses all over the country supported this. There's just a few of the organizations: American Academy of Pediatrics, American College of Physicians, American Medical Association, were all involved in designing and working on getting this law passed. So if you hear people say doctors and nurses hate this, well, that's kind of true in some parts of Oklahoma, but it's not true for the nation as a whole. I'm not going to talk at all about the politics of this because I'm a doctor and what I care about are patients. So I'm going to talk about this in relatively apolitical terms. If people have political concerns about this, we can talk about those at the end in the questions, and I'll try to do my best, but I'm not a politician, and that's not what I care about. So, but the goals of the Affordable Care Act were to improve people's health care security, to improve the quality of the care that we pay for, and to improve access to health care for the millions of people who had pre-existing conditions and couldn't get it. And certainly, I will be the first person to tell you that the Affordable Care Act is not perfect. There's a lot of room for improvement, and that I think is where we need to go. But going back to the horrible system that excluded, 50 million Americans from coverage, I don't think is the way to go. So let's talk about expanding the affordability and the access to care. One of the ways the Affordable Care Act did that is to expand the Medicaid program to cover people below 138% of the federal poverty level. It provided new subsidies for individuals and families to purchase coverage through a new health insurance marketplace that was supposed to have competition. And it expanded affordable employer-sponsored coverage through what's called a SHOP, which is a marketplace for small businesses. As a part of not denying people who have medical problems coverage, you have to have a mandate. Everybody has to be in the pool. The way, if you remember back to when the Clintons proposed health insurance, that was going to require that every employer had to cover every single one of their employees. That was the employer mandate. The Republican alternative to the employer mandate was the individual mandate, and saying, no, we need to make every person responsible for their own insurance. So that's how that wound up in here. And most people have to buy health insurance. We'll go through the long list of the exceptions as well. Okay, so what's happened already with the Affordable Care Act, not counting the marketplaces? So young adults are able to stay on their parents' plan to age 26, which covered millions of people after their high school to age 26 level. The Medicare prescription drug hole is closing, so the seniors are saving a lot of money on drugs. Small businesses have gotten tax credits to help them cover their employees if they choose to do that. There was something called temporary high-risk pools where people who were uninsurable through insurance companies could get insurance, and that's gone away now because of the marketplace coming up. Most people who have government and many people have private insurance can now get preventive services without a deductible copay or co-insurance. No longer are lifetime limits allowed on any health insurance policy. And 80 to 85% of the premium dollars that people pay in have to be used on actual health care. They can't be used for CEO bonuses, they can't be used for advertising, or if they don't spend that much on actual health care, customers get rebates, and a lot of people have gotten rebates over the last couple of years, or else if you get insurance through your employer, they got a rebate and your premiums should have been decreased with that. I will tell you, there was one company here in Oklahoma that was spending 50% of their premiums on actual health care, all the rest for CEO salaries. So this was something that really needed to be done. And community health clinics have gotten a lot of funding, particularly in rural and underserved communities, They've got money for expansion and building and all that kind of thing. So those are some things that have already happened long before the marketplace. And so what's been the result of the changes just that we've seen so far? Healthcare costs have been rising at the slowest rate in 50 years. Part of that probably due to the recession that we've just gone through and are still going through in a lot of places. But a lot of it, I think, is due to changes in medical practice because of the Affordable Care Act. And I'll explain more about that as we go on. The insurance rates in states that chose to have their own exchanges ended up being much lower than predicted. Places like New York and California. Not, unfortunately, Oklahoma. We got $54 million to set up our own exchange that we could have, dealt with Oklahoma insurance companies, and we gave that money back to the federal government because the governor chose to do that. 6.6 million seniors have saved more than $7 billion from the closing of the donut hole already, and it will continue to close, so they'll save more and more. And a lot of small businesses have used tax credits to insure over 2 million workers. So that's just all before we started with the marketplace.
There still is a donut hole, it's just not as big.
It's not as big, right,
Yeah,
right.
okay.
It goes away completely, I think 2020 is when it's completely.
And each year it gets bigger.
Each year it gets smaller. Okay, so more things that have made health insurance more secure for millions of people. Like I said, the preventive care, annual checkups, and immunizations, no lifetime limits on how much your insurance company will cover, and a big thing, they can't drop your coverage when you get sick. If you remember, the individual market was very bad about if you got breast cancer, when it came time in the year to renew your policy, they might not renew it at all, or they would jack your premium up like about 10 times as much so you couldn't afford it. So that was how they got rid of sick people, because that's how they made money, is taking care of people who didn't have much earnings.
And they still got it raised up.
Nope. Nope, that's a good thing. And no lifetime limits, as we said, and no dropping your coverage when you get sick. Okay. Starting 3 days ago, if you have a pre-existing condition, you cannot be charged more for it or get denied coverage for it. And that is in the marketplace and outside of the marketplace. You can't be penalized for having a pre-existing condition. And when you think half of Americans have a pre-existing condition, which could be anything from having had a heart bypass to having had a yeast infection, and that's a broad spectrum of pre-existing conditions. Asthma. My nephew couldn't get health insurance because he had a history of asthma as a child. So, okay. Some other things that people don't really know about because it's not controversial and so you don't see it on TV, but a lot of new doctors and nurses are being trained with particularly a focus on primary care, and the Affordable Care Act provided money for that training. And this is one of the reasons, I believe, for the improvement in healthcare costs, is that Medicare, in particular, is no longer paying just for more care, they're paying for better care. And hospitals are being penalized if you go in the hospital and they send you home like after 3 days and you're not well and they don't make you primary care appointments and so you bounce right back in. They don't get paid near as much for that second admission. And their overall rate of getting paid goes down because that's not quality of care. It's not keeping people healthy enough to stay out of the hospital. So I think that's had a big impact. And most of the systems that hospitals set up for the Medicare patients also happen for people who aren't on Medicare. So better post-hospital care is a big driving force, I think, behind keeping people out of the hospitals because that's where the expensive care is. So in 2014, we have a historic opportunity for millions of people to get health insurance. And here's a picture of LBJ signing the Medicare law in 1965. This is the most important important change in our healthcare system since that time. There are 3 new ways to get covered, although we still have the old ways. So the plan, as passed by Congress, was for lowest income people to expand Medicaid and get access through that. However, the Supreme Court changed that, and we'll talk about that in a minute. For higher income, the insurance marketplace, which is private insurance, it is not government insurance, it's private insurance, and also small business marketplace for small businesses of less than 50 employees, but also that is private insurance too. There's no government insurance in any of it. So let's talk about the Supreme Court. Okay, as originally passed, all the states would expand Medicaid to cover everybody below 138% of the federal poverty level, which is about $15,000 a year for a single person. The Supreme Court said the Affordable Care Act was constitutional. So if you hear people say it's unconstitutional, no. The people that decide that are the Supreme Court, they said it was constitutional, so sort of the end of the argument. And they said the individual mandate was also constitutional. But what they said was that states had the option to choose or not to expand their Medicaid program. So that's where we are. And as you can see, as of October 22nd, and it really hasn't changed much, except a couple of states like Ohio are kind of, and Pennsylvania are kind of considering it now. But about half the states chose to do it, and about half chose not to. And as you can see, Oklahoma chose not to. So let's talk about Oklahoma. That's the broad general picture of the law, but I want to talk specifically about Oklahoma and then about Pauls Valley. So for Oklahoma, we're not going to get a Medicaid expansion. Governor Fallon appointed a commission or something called the Levitt group that came up with a plan. They did a big study and said that Oklahoma should expand Medicaid kind of along the lines of what they're doing in Arkansas, where instead of giving people regular Medicaid, what they're doing is using that money to buy them insurance on the private marketplace, which is a little more expensive. So that was their plan, but nothing has happened so far. Insure Oklahoma was extended for a year because of political issues that, a lot of people like it. It's a good program. And so, in fact, many people think that building on, and the Levitt Group specifically said, one of the ways to implement the Medicaid expansion would be to expand Insure Oklahoma. Right now, no matter what, there's a hard limit on how many people can get insurance through Insure Oklahoma. So it's not everybody who is, quote, eligible who can get it. And we don't have a state marketplace, we have the federal marketplace. So in Oklahoma, 1 in 5 people under the age of 65 don't have health insurance. That's a lot of people. That's a lot of people. And this diagram just shows where the most people are, and you can see it's kind of in Little Dixie and Tulsa and Oklahoma City light up pretty good too. So the Medicaid expansion, if Oklahoma did decide to do that, who would qualify? A single person making a little more than $15,000 a year, and everybody below that. For a family, it's about $31,000 a year would qualify for Medicaid. That's 138% of the federal poverty level. And you can see up to a family of 8, gets up there, $52,000 a year. Okay. What happened because of the way the law was written, never anticipating the Supreme Court would do what it did, and then what the Supreme Court did, is that there is a gap of people who are not eligible for Medicaid under state laws, because in Oklahoma it's about 37% of the federal poverty level, plus if you're a single adult, it doesn't matter. You cannot get Medicaid, period. Unless you have something like breast cancer or some special little carve-out program. But in general, single adults are not eligible for Medicaid in Oklahoma, no matter if they make absolutely nothing. But those people who are below 100% of the federal poverty level cannot get subsidies in the marketplace because of the way the law was written, and then the subsequent Supreme Court decision, they were just sort of left out because the assumption was they would get Medicaid, but it's not going to happen in 25 states. So that's a lot of people.
And it's the poorest people.
Yeah, yeah. Okay. So we talked about it, people below 138% of the federal poverty level. The amount of money that would come into the state from the federal government, and remember this is our tax money that's going to the federal government, we're just refusing to take it back. It's being offered to pay for 100% for 2014, 2015,
which is crazy.
and we won't take the money back. We take money for our military veterans, we take federal money for our highways, we take money for lots of things, but we won't take it to help people get health insurance. But it's about $8.5 billion over 10 years. And that's money that would be coming into our local pharmacies, our local hospitals. And we already talked about that people below 50% of the poverty level have no options. They can get insurance through their employer, but if they don't get it there, they can't get it in the marketplace unless they want to pay full price, which is not going to happen. If you're making that little, you can't get it. People between 100% and 138% who would have gotten Medicaid basically for a really, really, really good deal now are going to get subsidies and buy private insurance, but they're still going to have to pay some. So anyway, 130,000 people, it's been estimated in Oklahoma, who would have qualified for Medicaid aren't going to get it because they're below 100% of federal poverty level. And that's going to have a severe impact on rural hospitals. And the reason is that because of a law passed under President Reagan, and signed by President Reagan, which is called EMTALA in the 80s, hospitals cannot turn away people with true emergencies, people with active labor. That's what that law is about. And so they have to take care of them, at least to stabilize them and transfer them to somewhere else. And that costs hospitals, especially in areas that have large numbers of uninsured, which tends to be rural Oklahoma, and to some degree also urban centers. It costs them a lot of money, and that they try to recoup it by raising prices for everyone else, but there's only so much you can do with that. And
Well, where is that?
I expect rural hospitals that care for a lot of uninsured people will close. Many of the rural hospitals in Oklahoma are already in financial distress, and when a hospital closes, that's often a major employer in the town. They have good wages generally compared to a lot of other things like Walmart. And, what business is going to want to locate to a town that doesn't have a hospital? It's going to be really hard to attract economic development to places that lose their hospitals. So this is a huge issue for Oklahoma, and I'm going to tell you with my rural Oklahoma roots and Kingfisher and stuff, it breaks my heart. And it's not, people think, oh, Medicaid, that's just poor people. If we don't expand Medicaid, and that hospital goes away, it's going to be everybody in Paws Valley trying to drive to Purcell if their hospital stays open, or so it's going to hurt poor people. All right, so I'm going to have, this is my kind of editorial comment on what to do if you don't make enough money to get a subsidy. If you're below 100% of the federal poverty level, there may not be anybody in this room, but you may have kids or family that are in that situation. If you are young and healthy, I would get a second job. I would get a third job. I would clean people's houses. I would scrub toilets. I would do anything I could to to get above that 100% so that I can qualify for subsidy. Mow lawn, I don't care, anything. If you're 63 and out of work because you got laid off or something and don't have your COBRA insurance or anything anymore, and you don't really have an option of getting a whole bunch more jobs and stuff to try to raise your income, you might think about going ahead and applying for Social Security retirement. They usually say, try to wait till you're 65 or 70 if you have a job, but, if you don't, if that can help you get above that poverty level so that you qualify to get health insurance, I would sure try to do that. If you're way below the 100%, there's no way getting one more job is going to make it. I would go ahead and apply for Medicaid and apply for Insurance Obama, because the worst they can tell you is no, and you're no worse off than you are now. If you can't work because of a disability, apply for Social Security disability. And I would say also, it's supposed to be get, not gear, but I would say, people in rural Oklahoma need to talk to their legislators, or state senators, or state representatives about expanding Medicaid. Because if you're way below, that's the only thing that's probably going to happen. Okay, so let's talk about the federal marketplace. It's open to people from 100 to 400% of the federal poverty level or above, but no subsidies above that. It's only available to get the subsidy if your employer doesn't offer affordable insurance. And businesses with more than 50 employees are required, or they have a penalty starting in 2015, and that's been delayed for a year, so there's no penalty this year. The rates are determined by your age, location, family size, and smoking. And there is a penalty for smoking, which subsidies won't help cover that. So it's trying to encourage people, especially when they're young, to quit. Coverage is for the pre-existing condition, even if you've got it. There are 4 choices of plan plus a catastrophic plan. We're going to go through this. That's really for age 30 and under, and people with some special circumstances. We'll talk about that. Most regular Oklahomans are going to qualify for a subsidy if you don't get health insurance through your employer. And the only way you can get the subsidy is to buy on the marketplace. You can buy insurance outside the marketplace all you want, but you can only get the subsidy through the marketplace. So if you make way over 400% of the federal poverty level, which for a single person is more than 40,000, I think, 45,900. So if you're making a lot of money, you may want to buy directly from the insurance company rather than in the marketplace because you will get a subsidy. Okay. If your employer offers health insurance, no. If you get Medicare, none of this applies to you. You're not eligible to buy in the marketplace. Don't worry about it. The only thing it's really going to do as far as the Medicare population is close that donut hole, and it cuts some of the amounts of the extra subsidies that Medicare Advantage programs were getting. So other than that, Medicare people are not really affected by this at all. Does your family make more than the income below? If they do, you're not eligible for a subsidy. Okay, so here's the income ranges that people can get the tax credit subsidy. But remember, it has to be that your employer isn't offering you affordable insurance. If you have to pay, say, 10% of your income to your employer to get insurance through them, you're eligible for a subsidy in the marketplace. Not on Medicare. You can't already be on Medicaid, which probably won't even bother. Or TRICARE is the one I'm on because I'm a military retiree. So if you're already in a government program, you can't get another one. And you must buy the insurance on the marketplace. You can't buy it outside of it if you want the subsidy. Otherwise, you can do whatever you want. Okay, so who is not required to buy health insurance? If you are a veteran and you're going to one of the VA hospitals or the VA clinics and you're enrolled as a patient there, that is considered acceptable coverage for the Affordable Care Act, so you're fine. You don't have to worry about buying more health insurance. Medicare, Medicaid, and TRICARE, I already talked about. Individuals with a religious conscience objection to insurance, and that primarily applies to faiths like, I think, Jehovah's Witnesses maybe, and the Amish. It has to have been a religion that's been around for a while. It can't be like we just started our own little religion. So we don't have to be doing that. People who are in jail, sorry, can't buy health insurance. And you don't get a penalty for not having it, so that's good. Undocumented immigrants are not eligible to buy health insurance in the marketplace. They are, however, eligible to get it through their employer. If they work for a company that provides it, even if they're not documented, they're able to get that. People who can't afford it or hardship, people with income below the tax filing threshold, which is $10,000 a year, they're not required to buy health insurance. Members of Indian tribes who get their health care or are eligible to get that through the Indian Health Service are not required to have it. Although, if they get it, there's special deals for them. They're really pretty good deals. So if they aren't near a facility, they might want to look into that. Okay. You can shop in the marketplace if you live in the U.S. or a U.S. citizen or legal resident in prison, which I'm guessing nobody here is. Who absolutely has to buy insurance in the marketplace? There's only one group, Congress and their staffs. Which, if you've heard some of the squealing, you know, some of them aren't happy about it. Now I'm going to talk about why do people need insurance in the first place. And I think most of the people in this room are old enough that we know what can happen if you don't have it. But why do young, healthy people need it? Well, I gave you the example of my friend who got Guillain-Barré. But like home and car insurance, most of the time, every dollar you spend for home insurance is completely wasted until the tornado hits your house, and then it's a great deal. So as long as you avoid catastrophes, it's kind of silly to have insurance, but man, look at those poor people in Moore who didn't have house insurance. Mm-hmm. I mean, that will wipe out people's entire financial security in one fell swoop. So health insurance is the same way. And what happens if people go to the hospital and they don't have health insurance, they're going to get treated for their emergency. You know, they might need a heart bypass or whatever. But that hospital is just going to say, "Oh, I'm sorry, you don't have any money. We're not going to worry about it." No. They're going to, try to get that money out of you everywhere they can, turn you over to the collection agency, which can destroy your credit. People can end up in bankruptcy, won't be able to get a loan, won't be able to get a job because many jobs now check people's credit rating. Sometimes you can't even get a cell phone if you don't have a decent credit score, so it can really, really hurt people. The good news is that now the maximum out-of-pocket expenses for any person who has health insurance covered in the marketplace, and I also think, but I'm not 100% positive, but I'm pretty sure that even the ones that if you buy your own policy from Blue Cross Blue Shield, not through the marketplace, that there's a maximum out-of-pocket expense of $63.50 a year. So that's in addition to your premiums. So whatever your premiums cost is one thing, but nobody is going to get hit with $200,000 or $400,000 of medical bills that the insurance won't pay for. If you have health insurance. If you don't, same deal as it always was. They're going to hit you up for it. A lot of times doctors, clinics won't take you if you don't have health insurance. And in the old system, paying health insurance, and really on your home too, I mean, you don't get any preventive care on your home for free. But under the new health insurance, you do get preventive care. Even under the catastrophic plans, you get 3 wellness visits per year. You get some preventive medicine services like flu shots and that kind of thing. Younger women, depending on who you work for, it turns out, may be able to get birth control, that kind of thing. So colonoscopies, mammograms, those are all preventive care. And if you're over 50 and haven't had a colonoscopy, I'm going to put an employee for that. And also, if you haven't had this shingles vaccine, that is also a good deal. So. And under Medicare, it's covered under Medicare Part D. So it's not through the Part A or B, but it's Part D. You can get the shingles vaccine, and it's recommended for everybody over 60. Okay, that's my editorial comment. I'm sure you all know that insurance companies negotiate big discounts off the care, off the sticker price for care. And if you don't have it, you're going to pay sticker price. Parents' financial security, if you have children who are uninsured and they get hit by a bus or a car or a train, you're not going to let them die. You're just not. And it can destroy your own financial security. Here's an example. I recently had cataract surgery. Oh, best deal I ever had. But here's my bill for just the anesthesia part of it, which was literally half an hour in an operating room with a guy talking to me and giving me a little bit of propofol. That was it. $720. Well, my insurance company paid $109, actually TRICARE, and I paid $36.59. And they wrote off $573 of the bill. Well, if you don't have insurance, they're not writing that off.